There is a critical need for healthcare workers at Baptist Women's Hospital and Baptist Children's Hospital. Today, the hospital held a hiring fair focused on high-demand areas like the NICU and labor and delivery positions. Hospital leaders say have been sitting open for weeks or even months. ABC 24's Ezekiel Telemaco has more on why it's been so tough to hire and why some new nurses say they're still struggling to land jobs.
Baptist Women and Children's Hospitals are looking to hire experienced nurses and clinical staff, roles they say are critical to keeping patient care running smoothly.
We are looking for experienced nurses in our neonatal intensive care unit, labor and delivery unit, our mother-baby unit, and all of our pediatric units. And we're also looking for experienced clinical professionals in our lab and radiology departments.
CEO Allison Chase says the issue isn't just about filling jobs, it's about getting enough qualified people to apply.
It's just a lack of overall candidates applying. So I think as time goes on, people are getting maybe less interested or less exposed to healthcare in general as a profession. And so that's something that our team is really passionate about, is trying to get as many people in our building and exposing them to different healthcare professions.
Chase wouldn't share the exact starting salaries, but say they pay above local competitors. According to Incredible Health, the average annual registered nurse salary in Memphis is $68,510, about 17% below the national average of $82,750.
You're wanting these positions to be filled, but then the pay doesn't exactly quite equal. So that's definitely been an adjustment for me as well, like entering this hiring market as a new grad.
Tyra Dodd recently graduated from the University of Tennessee and has applied to hospitals across Memphis, including surrounding states, but says she's been turned away after asking for a salary that matches the demands of the job.
Even with, nursing shortages and stuff, that's very prominent as well. So as a new grad, I would want to fill those spaces and would wish it wasn't as maybe strict on certain things, and I'd be willing to negotiate whatever salary.
Hospital leaders say every role counts, especially in one of the busiest maternity units in the Mid-South.
We have the highest labor and delivery stats in the city, so we deliver just over 5,000 babies, and so that's just one unit.
On one side, hospital leaders say they need skilled workers now to keep up with demand, and on the other, nurses both new and experienced say pay and hiring practices still leave qualified candidates on the sidelines.